Hello everyone, my name is Lenida and I'm doing SBAR scenario and video assignment on nephrology course under Professor Janet Daniels. The first scenario is hemodialysis. Situation. Hello Dr. Ross, I'm Nurse Lenida in the dialysis unit. Mrs. Lee is a patient in Station 2, Machine 4 who complains of headache, dizziness, nausea and vomiting. Mrs. Lee presented herself with her daughter in the clinic this morning. Mrs. Lee is a female, 65 years old widow. She came to the clinic for the first time and is going to be returning 3 times a week for hemodialysis, 3 hours each session. She suffered from chronic kidney disease many years ago. She also has diabetes mellitus type 2. Mrs. Lee is alert, responsive, and cooperative before the treatment. However, noted dyspnea during exertion. Fistula on the right arm for bruit and trill are audible and palpable. Recent laboratory results: band 83 millimoles per liter, creatinine 21.4 millimoles per liter, sodium 125 millimoles per liter, potassium 6.5 millimoles per liter. No abnormalities seen on ECG. Ultrafiltration rate 650 per hour, blood flow rate 350 mils per minute. Dialysis flow rate was 500 mils per minute. Medication that she's taking at home are amlodipine 10 mg once a day, metformin 500 mg twice a day, Lasix 5 mg once a day. Patient has no known allergy. Patient is in full code. I think patient experiencing dialysis disequilibrium syndrome. This is because after 2 hours of hemodialysis, the patient was having headache, nausea, and complaint of dizziness as well as vomiting. Edema on both feet are noted. Vital signs prior to procedure is 165/90 of his BP, HR 70, temperature 36.6, and O2 set of 98%. Doctor, I think you need to prescribe hypertonic solutions such as mannitol. You also need to stop dialysis. Monitor the patient's vital signs regularly. We also need to reduce hemodialysis treatment to 2 hours, reduce blood flow rate to 150 mils per minute. CT scan to rule out cerebral edema, you need to order that too. Scenario 2, peritoneal dialysis. Situation. Hello, Dr. Chan. I am Nurse Lenida from dialysis unit. I have a patient here. His name is Albert Jones, who is on peritoneal dialysis, who has an infection on the catheter exit site. He complained of abdominal pain and cloudy effluent. Mr. Jones is 70 years old and was on peritoneal dialysis on continuous ambulatory peritoneal dialysis for almost 1 year now. He was suffering from acute kidney disease injury for 5 years prior to peritoneal dialysis. The current peritoneal dialysis regimen is 4 fluid exchanges per day, 2,000 ml each time, nocturnal storage, an ultrafiltration volume of 900 to 1,000 per 24 hour, and no urine. Urea clearance index of 1.96 to 2.34 per week. He has no allergy and he's a full code. Doctor, I think Mr. Jones developed peritonitis due to the infection of the catheter exit site migrated to peritoneum. Upon inspection of the catheter exit site, it appears to have erythema, swollen and purulent exudate. Patient stated that he is unable to do hand hygiene prior to the procedure. Dressing on the exit site is unclean and there is no womb yet, no blood test done. Blood pressure 130/70, he is afebrile, heart rate 72 beats per minute. Denies diabetes mellitus and no abnormalities on cardiopulmonary. Patient is alert and coherent. Doc, I need you to prescribe topical as well as oral antibiotic to cleanse the antibacterial soap and water. Educate the patient about hand hygiene before and after procedure. We need to inspect the exit site regularly too. To apply clean dressing regularly and apply antiseptic technique. To advise the patient not to immerse the exit site by doing activities such as swimming. You need to order blood tests, PD effluent smear and culture tests. Also order for one swab, wound swab for culture and sensitivity. Thank you.